I'm Leslie Paulette, and I'm a registered midwife at the Fort Smith Health Centre. I provide care to pregnant women, new mothers, their babies, and their families from the time that they first find out they're pregnant until their babies are at least 6 weeks old, and sometimes I provide care to moms for at least 12 months after their baby's born. New moms just want to know what it is that we can offer to them and how we can help them to have their baby, and I let them know that we provide continuity of care, so from the time they first find out they're pregnant until the time they have their baby and beyond. We'll work with them, we'll form a relationship with them, and we'll help them to make choices that feel right for them. So we're there to support them with information so they can make their own best choices about how they want to look after themselves, where they want to have their baby. We're there in a partnership with them. There are 2 midwives here, and we also work with a registered nurse, so the 3 of us provide care to the clientele of the program. And we also work with other care providers here, physicians and registered nurses who are here in Fort Smith, as well as specialists such as obstetricians who are up in Yellowknife at the Stanton Hospital. And then we refer to other allied healthcare providers, physiotherapists, public health nurses, nutritionists. We can refer to social services, community counseling, whatever array of services women need in order to get the care they need. I like to focus on the fact that we use only what technology we really need, and we pride ourselves in having a very low intervention rate. So the skills that we have in our hands and the experience that we have as care providers, that's primarily what we work with when we provide care to women and their babies. We have technology like ultrasound, electronic fetal monitoring, medications for pain relief, emergency medications, and we'll use those when it's appropriate. But by and large, we try to help women to have as natural an experience as possible with as few interventions or technologies as we can. Fort Smith is my home community now. I've lived here for more than 30 years and I enjoy living here, and I wanted women to have the experience of good maternity care here in this community, continuity of care. I really enjoy that aspect of being here and getting to know women, working with them through their pregnancy and beyond, and offering them choices both here in the community for low-risk deliveries and also for women to make use of our regional services. I like the personal contact I have with clients. Working in a small community in the Northwest Territories as a midwife, you become the expert on maternity care in your community. You are the backbone of maternity care service, so you have perhaps a more expanded scope than you would in a larger center where you would refer a lot of women away to other services. Here you are the backbone, so you take care of women who have more complicated pregnancies as well as those who have totally uncomplicated low-risk pregnancies. You get to work very much in a multidisciplinary team, and you get support from specialists, but often you're providing care to women who have special needs, and that's perhaps different than in southern Canada. I think to become a midwife, that call has to come from somewhere, and you have to feel that from within if you're going to be able to sustain the tremendous effort that it takes to be a midwife over a number of years. There has to be something in your gut that calls to you and says, this is what I really want to do, this is what I really feel I am meant to do. And that's when you'll be able to pull from within all the things that you need to bring to a pregnancy, to a birth. Sure, when things are going smooth, that's great, but sometimes there are times when the going gets a little rough, and you have to be able to really reach within and pull out that part of you that says, I'm really meant to be doing this. I think that being a midwife here in the North is a way of helping to bring birth back to communities that have lost birth in the last couple of generations, and bringing birth back to communities is a really important part of helping communities to heal from the many disruptive influences that have come through communities in the north. So it's a part of healing a community, and that's what really makes the work special to me.